Friends, welcome to ShareTreck. This is Raj here. In today's video, I want to talk to you about a company that seemed likely to succeed and has failed. The reason I bring this to you is to illustrate the risks involved in the business as fortunes hinge on FDA approval. The company had a great website, a pipeline page, tie-ups with reputed organizations, and looked good, like most of the genomic companies that we profile in this channel. However, things went bad, and I have a story to tell. So let's get started. Welcome back. This story is about Intarcia Therapeutics based in Boston. Let us check out their website for context and then get back to the current state. So here we are on the website of Intarcia, and this is the home page, and it looks like a regular company that we would generally profile in our website. And now if we were to go and look at the leadership out here, and we have the same structure out here: chairman, president, head of discovery, chief medical operations, and chief scientific officer, and all that. It all looks good. And then if we were to look at the pipeline, we have a pipeline diagram out here which shows ITCA 650 at the almost beyond the clinical trials and having filed with FDA for approval. And this particular company aims to manufacture devices which can provide an environment in which the therapy molecules or medicine can be maintained in an adequate temperature and can be maintained fresh for release over a period of 6 months into the patient's body. So generally these devices are implants, and the idea was that they would come up with this product called ITCA 650/12M, and that would enable type 2 diabetes patients to have an implant that would keep on feeding the necessary therapy into their body so that they don't have to take insulin injections for prolonged periods such as 6 months or a year. So that was the idea behind this particular product. And they also had tie-up with Bill and Melinda Gates for HIV pre-exposure prophylaxis product. Again, this is a high-profile organization to be tied up with this company. So at a glance, everything looks great. But unfortunately for them, their application to FDA for ITCA 650 did not succeed. And that's where the company ended up with problems. Let's talk more about that. As you have seen in the website, their main candidate was ITCA 650 that aims to provide an implant that can help TD2 patients, that is type 2 diabetes patients, avoid insulin injections for around 6 months at a time. FDA has denied Intarcia Therapeutics' final request for a hearing to review ITCA 650 after hearing first rejected the therapy 5 years ago. In 2019, Intarcia resubmitted its ITCA 650 application to FDA, and FDA got back to them citing the issues from the original submissions were still present. Since then, it seems the company has been unable to address FDA concerns comprehensively. Reports indicate that currently there are some discussions ongoing with FDA, but most of its executives have departed. This should serve as a cautionary tale for investors and a reminder that we need to do risk management in our portfolio to avoid getting burnt if one of the companies that we invest in were to fail. And that's the lesson that I wanted to bring across to all of us with a quick review of this company. I don't want to go into too much details about ITCA 650 because now it's a moot point. The product is not going to come up. Therefore, I didn't go into much details about how it works and what are the components, the way we do for other genomics companies where there are pipeline items that we discuss. But having said that, I guess that the lesson basically is that when you look at your portfolio, when you look at your investments, you have to make sure that you manage the risks. Overall, I would suggest that you should have a little exposure in real estate, a little bit of exposure in precious metals, some exposure in shares, and some exposure in fixed income. And that's the way you can distribute the risks. And within the share portfolio also, You need to distribute your risk across the industries. Like, for example, you would have a part of it in engineering sector, part of it in software sector, part of it in hospitality sector, so that despite the ups and downs in the economy, you're always balanced your risk across the portfolio. And within the industry, you don't put all your eggs in one basket, but divide it across. And that's where you have the ETFs, which are really helpful, because if you want to target a particular industry, there are industry ETFs. You could just buy the industry ETF and forget about worrying about covering each and every company out there. You get the overall benefit. So you could have an ETF to focus on software industry, an ETF to focus on semiconductors, an ETF for genomics, and then forget about it and just allocate your budget. So there are various approaches, and all these could be a separate video. But suffice to say, for today, I just wanted to let you know that if you're looking at any company in the genomics sector or in the medicine sector where FDA approval is required, please do not go just by the looks on the website, by the looks of the pipeline, and by the partners that they have. You have to be very, very careful to evaluate the company in order to save your investments. With that, my friends, I'd like to bring this video to an end. I hope you liked this video. If you did, please press a like out there. And if you're not yet subscribed, please subscribe and help us grow this channel. Thanks and have a great day. Bye for now.